Developing Empathy in Complex Situations, presented by Jessica Legg and Jamie Lynn Rara.
In this video, we will discuss two important concepts in communications, empathy and sympathy, and the pillow method.
Empathy. Empathy is defined as the ability to project oneself into another person's point of view, so as to experience the other's thoughts and experiences. It involves three dimensions. The first one is perspective taking. It's an attempt to take on the viewpoint of another person. The second is emotional, where we experience another's feelings. And the third is concern, where we care for the welfare of another person.
Sympathy. Sympathy can be defined as feelings of compassion for another person. However, we sympathize only when we accept the reasons for another's pain as valid. As opposed to sympathy, empathizing allows you to understand another person's motives without requiring you to agree with them. After empathizing, you will almost certainly understand them better, but sympathy won't always follow.
The pillow method is a tool for building empathy. The pillow method is a way of understanding an issue from multiple points of view, and not with an I'm right, you're wrong attitude. It is a method that attempts to address situations that are very serious or complex in nature. A pillow has four sides and a middle, and this illustrates how a problem should be approached. The main goal of the pillow method is for both sides to see each other's point of view, and in so doing, develop empathy for one another.
Position 1. I'm right, you're wrong.
Position 2. You're right, I'm wrong.
Position 3. Both right, both wrong. Position 4. The issue isn't important.
Position 5. There's truth in all perspectives.
Now that we are familiar with the pillow method, let's apply it to a scenario that may be encountered in a healthcare setting. A doctor in a busy hospital is treating a 1-year-old girl who has anemia. Her condition is so severe that she is at risk of congestive heart failure, and the most effective course of treatment would be a blood transfusion. The little girl's parents, however, are devout Jehovah's Witnesses and are refusing any treatment involving blood products. Obviously, this is a very difficult and tense situation where emotions on both sides could quickly become escalated. How should the doctor respond to the parents? How should the parents respond to the doctor?
In Canada, a few legal cases have set the precedent for how patients who refuse therapies on religious grounds should be treated. In cases involving adults, they have the right to refuse treatment, and the doctor may not interfere with this right. When the patient is a child, however, the law has sided with doctors. Children are to be treated despite their parents' wishes, and the hospital may begin legal action to allow them to treat the child as is deemed necessary. Neither position is right or wrong in the context of this presentation. That's a debate for an ethics class. We are only concerned with the communication aspect. In our case, the patient is a 1-year-old girl. Chances are the doctor will initiate legal proceedings and the girl will be transfused. This is obviously a tense climate. However, for the sake of the patient, both sides should attempt to maintain open and respectful lines of communication. Even though the doctor may realize that they are legally right in this situation, the pillow method can still be effectively used to develop empathy and enable communication that is mutually respectful.
How can both sides use the pillow method to facilitate better communication?
Position 1. I'm right, you're wrong.
I will treat her regardless of what you believe.
She will not be treated even if this means her death. Position 2. You're right, I'm wrong.
I understand your need to act in accordance with your faith and how not doing so would cause you great anxiety.
We understand your duty and obligation to treat all patients with the best therapies available and how it must be frustrating for you to hear us refusing them. Position 3. Both right, both wrong.
I understand your need to act in accordance with your faith. However, I cannot risk this child's life.
We understand that you wish to treat her in the best way that you know how. However, we cannot allow the transfusion of blood products. Position 4. The issue isn't as important as it seems.
It is not important who is right or wrong. However, I empathize with your position.
It is important to us that she is treated in a way that is compatible with our faith. However, we appreciate your care for our daughter's well-being. Position 5. There is truth in all perspectives.
Now that I can empathize with your point of view, I will do my best to treat her without the use of transfusion, and only use it as a last resort.
We appreciate your extra efforts. It should be also noted that in many Canadian hospitals, local groups of Jehovah's Witnesses have established hospital liaison committees, whose purpose it is to help both doctors and patients find adequate treatments that are in accordance with their faith.
We can see that using the pillow method may enable better communication between both parties. In this case, it accomplished the 3 dimensions of empathy. Beginning with perspective, both the doctor and the parents have attempted to view the issues from one another's perspective. For emotional, the doctor empathized with the parents' anxiety and the parents empathized with the doctor's frustration. Lastly, for concern, the doctor is showing concern for the parents' wishes, and both parties have the common concern for the child's health and welfare.
We can also see that mere sympathy would not have sufficed in this case, as neither side would have been likely to see the other's point of view as valid. Remember, empathizing allows you to understand another person's motives without requiring you to agree with them. After empathizing, you will almost certainly understand them better, but sympathy won't always follow.